Hey guys, it's me. Um, so finally home. I got discharged, and everything seems to be going okay so far. I went through the cryoablation yesterday. Um, the doctor told me afterwards that both of my pulmonary veins were very active with electrical outputs that they were able to get them taken care of, which was the main cause of my AFib. Um, got a couple of, IVs in this arm, and I got big, not really big bandages, but they put sutures right after the procedure in my groin, on both sides of my groin, since they went in both sides, and they took them out right afterwards, and put big like band-aids about a little bit smaller than a credit card, I would say, on both sides, and just keep an eye on them. I will be able to shower tonight, so I'll be able to take them off to see how big the suture, the incision site is, and then afterwards I'll have to put some more back on. And I'll have to do that every day for 3 days. So pretty much getting back to the pre-op. Pre-op went pretty good. I left home about 7:15 to get to the place that's about an hour and a half away, and Uh, got there about 9. My appointment was 9:15, and I got there at night at 9 o'clock. And we got there. I was video live Facebook live chatting my whole experience, and I'm now going to try to do this on YouTube and see how well I do. Um, so got off topic there. Sorry. So we made it up there at 9 o'clock. And I waited about 45 minutes, and I got checked in and waited 45 minutes. Got pre-registered before going back to the room, and once everything happened there, um, I sorry, my throat is still a little scratchy from when they did the endotracheal tube CT scan down my throat, and went to the back of the room, and they had a gown waiting for me, so I was able to get the gown on. And the only thing I could have on was the gown and my socks under it. And I had my wife there with me, and my wife's best friend, so she can keep her kind of occupied while I was in procedure. Um, then after that, the two nurses came in. One of the nurses was the main one that's going to be watching me through before and after the procedure and my overnight stay. The second nurse came in and pretty much put the IV right here and one right in the wrist here, because that's what the doctor preferred, because he goes on the right side and not the left side. Um, Went through a whole medical history, asked me a bunch of questions, and pretty much was kind of like waiting around for about a couple of hours. About an hour before I went up, I had the doctor come to me and told me what was going to happen, what they were going to do, and pretty much uh, pretty much told me exactly what's going to happen, and they're going to go right into the pulmonary vein and freeze it with the balloon on both pulmonary veins, and it shouldn't take no more than 2 to 3 hours to complete everything, and should be good to go. And after that, had the anesthesiologist come in. That anesthesiologist that came in was pretty nice. Had a really good bedside manner. It was very funny. He had kind of a dry humor to himself, but I tend to like people more with that has dry humor and everything. And told me, asked me about any, you know, the typical thing. If I had anesthesia before, did I have any issues with it before? And I told him no. And I asked him a bunch of questions reference to anesthesia. I mean, I've had it before when I had knee surgery, so I didn't have no issues. But still, but so I didn't have any issues with that. I told him, and so pretty much after that he left, and it was about 11 o'clock, 11:30. Um, and then the staff came in and said, "Hey, we're about to take you up. Just get yourself prepared." And at that point, I had to go use the restroom. I think I went to the restroom like a couple of times before I went up. I guess it was anxiety or something. I usually don't have that with just going to go pee like that. Um, about close to 12 o'clock, I went up to the pre-op room um, and had my wife go up there with me, and had the lady there was up there asking me questions, and then another nurse came in to ask me questions, and the anesthesiologist came in and for literally asked me, "Hey, has anything changed since I last saw you?" Which was like 30 minutes before I went up there. Like, nope, nothing has changed, and I told him I was a little anxious that would he be able to give me anything for it. He's like, "Yeah, absolutely. When we get in the operating room, we'll get you something to kind of knock the edge off a little bit." And went from there. He left, and then they were getting all this stuff like ready. And next thing you know, they were telling my wife it's time for her to go. And before she left, we kissed, and then she went on her way. And then I got pushed off to the operating room. As soon as I went in the operating room, like literally to my left, there was like this huge 90-inch screen, flat 90-inch flat screen TV, and it had like the 3D picture of my heart, and they had like this other part of the screen. There was like three parts to it. There's one on the bottom that had the 3D picture of my heart, the middle, the top part, the whole like top screen, the whole top screen had like a thing where it measured out the electrical impulses, and then the other one I just couldn't remember. I just know I saw those two distinctively. Um, got rolled into the operating room, and there was a little bit of logistical issues, but everything seemed to work out. They I kind of went onto the from my bed to the operating room, and not the operating room, but the bed to the operating table, and uh, got on the operating table, moved back just a little bit for wherever they wanted me positioned, and then they Uh, they started getting me all hooked up with the stickers for the monitor and everything, and then getting me wired up. And then anesthesiologist person came in and was doing his thing. I mentioned to one of the nurses, like, "Look how big that screen is. It's so big." He's like, she was telling me, "Oh, it would be a shame we could. Wouldn't be a shame if we could watch, football, wouldn't it?" And I was like, "Yeah, absolutely. That'd be cool." Um, so after that, anesthesiologist, I told him, "Hey, are you going to give me something for my anxiety?" He's like, "Yeah, I definitely will." And he gave me like 2 milligrams of Versed. As they were doing that, they were getting stuff on my back. This lady didn't even warn me, but she put like a bunch of cold gel stickies on my back, lower back, and then up my middle of my back, and they put like electrodes on the back of my back too, um, and and then also I forgot to mention that another guy came in before I went up and told me that the doctor wanted to do an endotracheal tube CT scan of my heart just to make sure that there's no clots. So they basically went into my airway or my esophagus, and just to check to see if there was any blood clots in my heart from where they can see there. So my throat is like still killing me from that. Probably like that for a couple of days. Um, and then uh, back to the operating room. After they put that stuff on there, the Versed kicked in about 2 minutes later, and pretty much I'm so I pretty much was like kind of went from being like anxious to about like pretty chill per se. And once that happened, the nurse put the oxygen mask over my face, and also about a minute or two later, this is a point I think they were starting to get me propofol. Is like the nurse immediately started saying, "Okay, we want you to think about a really good place you would like to go on vacation." And I kind of chuckled a little bit, And then after that, I don't remember anything after that. I remember vacation, and I chuckled, and then next thing you know, I was waking up like kind of coming to, as they would say, when you're coming out of anesthesia. Um, I was kind of like kind of really groggy, and I was being transported from the OR to the PACU, where they stage you while you're coming out of your anesthesia. Um, and I noticed right away, like as coming out of it, I was immediately not say alarmed, but not panicked, but noticed that I had a little bit of chest discomfort, and that's part of what happens when they go in and ablate. That your heart kind of gets irritated, so it's like endocarditis. That happens, and it causes you to have some like chest discomfort, and for the most part, while I was in the PACU, I was struck up the conversation with the nurse, asking her some questions. Every 15 minutes, she was checking my incisions, make sure that they were not swollen or getting hard for a hematoma. And I told the nurse, like, hey, I'm not trying to be big baby or anything, which I probably was. My chest really is really discomforting, and she's like, "Yeah, I'll get you some fentanyl for that," and she did, and it took the edge off there for probably about an hour or so. I had to be in the PACU for an hour, and after that, uh, I went to um, I went from the PACU back to the room. While I was being transported back to the room, I was striking up a conversation with transporters. I'm a person that likes to talk to people. I'm a very friendly person. I like to strike up a conversation with anybody. That's just my personality. That's just the way I am. And I walk in. But I was delivered back to the room with my wife and my wife's best friend, and I was surprised I didn't go right back to sleep and everything. So got back in the room. And nurse came in immediately, asked everything, how are you feeling, everything, and I was like, I have a headache, and I was not nauseous at the time. While I was having chest discomfort. That was really my biggest thing, and I was having stinging on my right side of my incision site. But she did check both sides; they seemed to be good. I had a Foley catheter in at the time because I can't move for like 4 hours, so that was uh, that was interesting. But they told me that that was going to happen. But my throat was really, really like it was like I would say like a strep throat kind of like feeling in my throat because I keep coughing, and then I have chest tightness. Sorry, um, I'm trying to get everything situated here, but it's just like a vlog of my day one, um, from post op and day one. Um, After I got in there, she checked the incisions. About an hour later, she checked them again, and she actually cut the sutures out. They were really tight. They had make sure that for some reason they didn't want to apply a lot of pressure, and the sutures worked really well from what they said. So after that, she cut them off, the sutures out on both sides, and then put band-aids, big band-aids on there. And after that, um, pretty much just kind of like was talking to my wife and my best friend, and everything, and just trying to strike up a conversation. After that, every hour, the nurse would come in and check um, my groin just to make sure everything was good. And about let's say about 5 o'clock, I did order dinner or lunch or dinner or something. But I was hungry, but I was not hungry because I think I was still weaning off the anesthesia. And the food came in, did not even touch it. Like I literally, the only thing I did was really eat crackers, and then I drank water. That was really more of a suffice for me. And there was a it was like a club sandwich that they had with two cookies and a bag of chips, and I didn't even really want to look at it. It was like kind of like it disgusted me at the same time. I'm like, it's kind of weird how I was hungry, but I'm not hungry. But I ate crackers and water, and that was okay. Um, I got up for the first time about 6 o'clock, and and that's when things kind of got a little weird for me. So I got up. I was in a laying position, and I got up to the sitting position on the side of the bed with the nurse being there, and I was like really, really dizzy. And I told the nurse like, give me just a moment to get my bearings all intact. So that was probably like 20 minutes of me just sitting there trying to get myself together. And I called her back, and she helped me get to the bathroom, and I peed on my own. And God, that hurt. Oh yeah, forgot. They took the Foley catheter out, and that was there. There's no describe. Can't really describe the feeling of that coming out. Went to the bathroom. Your first time you pee after your catheter comes out, it burns like it's not bad, but it's pretty painful. And after that, I sat on the chair after went to pee or urinate, whatever you want to call it. It doesn't matter. I went to pee. Um, and while I was sitting there, while the nurse was changing the bed, I started developing these wavy ocular vision. I would consider it like something similar to an ophthalmic migraine I would have like once every few years or so that I would have. And like I could look straight and I can see it fine, but like this part, like my peripherals, it was like nothing. I could see nothing, and I was trying to describe it to my nurse, but I was still kind of out of it. Still, after 5 hours out of being in the operating room, and so pretty much, she went after I laid down. I went to sit back down, and I laid down. It went away. At that point, when I was laying down, the doctor came in and asked me what was going on. I explained to him what it was. He's like, "Well, if you have that happen again, we'll probably give the nurse to give me us a call back because it could possibly mean that you could have a stroke," which I was like highly doubt that would be the case, but you don't want to rule anything out and just assume in the medical field because you just don't know. And after that, the night nurse came in and everything, and pretty much the night nurse was kind of like, whenever you need me, just let me know. I'll check the incisions every 4 hours. We'll be cool at that, and that's cool. I called them every so often for like crackers and water or ginger ale, and really about 8 o'clock at night, I started developing like really really bad headache and was nauseous. And between that, like my headache would go away, and then I would get really nauseous. And when my nausea went away, I would get a headache. So it was like kind of a extreme back and forth until about. It was kind of weird. I put my head on my hand on my head, and when I was laying down, it kind of went away a little bit. But about 11 o'clock, everything seemed to subside, and then I went to the bathroom with help for the second time, and still when I was peeing, it was still burning, still because of the lubricant that's in there, and and then I didn't have that happen again after the second time of getting up. It didn't happen again, and then I sat down and actually ate my ham and cheese, my club sandwich. I ate my chips and drank some ginger ale, and I was pretty hungry, so I started eating more of the crackers that was on the table, and and then after that, I was like kind of like my chest pressure and stuff was kind of, was fine. A little bit, my throat was still bothering me, but I was kind of in and out of sleep. I went to sleep for like an hour, then woke up, and then went back to sleep and woke up at 2 and went to the bathroom. Woke back up an hour, and the nurse was checking everything on me, make sure that my vitals were good and my incision sites were good. About 4 o'clock in the morning, I went to the bathroom, sat back down, and I started experiencing a little bit of fluttering. Not too bad, like 10 or 15 seconds worth of it, like the heart rate was like going back in a rhythm or something like that. And that bothered me a little bit, but not to the point where I would get like panic mode. After that, I went back to sleep for about 7 o'clock, and woke up. Got breakfast. I went to the bathroom. Everything seems to be good. I went twice that morning without having help, and after that, the nurse came in, talked to me about getting discharged and everything, and then actually the doctor came in afterwards, and we spoke, and how he was telling me how everything went. That majorly everything was in the pulmonary vein was super active, was like firing off like a bunch of um, torpedoes, and but for the pulmonary veins. So expect to have your chest discomfort. Expect to have some AFib, um, that won't last too long, but just expect it during the 3 months while your heart heals up. And for the most part, yeah, I mean, the procedure went good. The staff was really good. Very informative. Very caring. Very had a really good experience at this hospital that I went to, and then I got discharged, and made all the plans of the post op, not post op, but after discharge, to see my cardiologist in like 4 to 6 weeks to follow up with that, and then in 3 months I would see my EP doctor again to make sure everything is good, and then after that, I can be off. I'm already off my diltalzium, but I'm still on my beta blocker, which is sotalol, and then I'm on Eliquis, which is a blood thinner that I have to have for like 3 months. So with rugby season starting, which will be in like April, late March, early April will be just around the right time for me to be able to get back into it, because that was really the at the end of my fall rugby season, right before we went to the tournament, I started having I had an AFib moment, and I started becoming symptomatic with it, where um, I was getting shortness of breath and stuff. This was like new. This was like something super new that I've never had before with AFib. Shortness of breath, really bad chest pressure, and was getting dizzy and tingly. And I went to the hospital, and I was there in a cardiac PCU for 4 days. And at that point, I went to tell the cardiologist, let's go ahead and get the best EP doctor that we can, and he referred me to this guy that was in Lynchburg, and went with him. So my quality of life for after that was down for like 2 months. Like, I was taking the sotalol and the cardizem, and my heart rate was like really low. I had to. It's kind of weird. I was when I was picking stuff off the floor. I had to breathe to it. Breathe when I was picking stuff up or lifting anything, because I felt it was kind of weird. It just weird how everything was when I had a lower heart rate and could still feel everything. So I'm happy I'm off of diltalzium. My heart rate is back at its normal, like 70, 80 beats per minute range, but I'm on the sotalol, and my Eliquis for the time being. So after everything, basically, after you go into procedure, and if you're having a cryoablation, they go in the pulmonary vein, which is the main active site. They freeze the crap out of it, and that should stop everything. And then you come out of the procedure, and you lay down in the bed for 4 to so hours. After that, you're able to stand and use the restroom, able to eat, do normal things. You'll just notice that your throat's sore from when they went down in your throat, or your chest pressure. For me, anybody could be different. It could be different for anyone. Just to let you know. Um, but for the most part, they wasn't both growing, both sides growing, so that's typical for them to do. Um, and let's see what else. For a solid, you can't do any heavy lifting or anything over 10 pounds for a solid week. So basically, I'm not going to pick up anything unless it's like a small water or food or anything like that. So I'm off for a whole entire week from work, and they have approved it, which is great. I don't have to really take any time off of my personal time to do that. But um, So be prepared for that. Um, have like if you're able to have your phone, get yourself prepared for like a bag for overnight if your doctor asks you to stay overnight. I just really was pretty much watching YouTube stuff the whole time, just kind of like keeping my head out, off of everything the whole time. And I thought about doing a Spotify list, but it really, I had my best friend and my wife's best friend and my wife there, so that kind of was able to talk to them the whole time. Um, Other than that, being off for a week and then you'll stop taking your antiarrhythmic medication. You'll be on your beta blocker if you are on it, and then you'll be definitely taking blood thinner for 3 months, because the 3 months is like a transitioning of when your heart is from where your heart was and where they ablate it into when it heals, whether or not everything was successful. So they give you that 3 month transitioning time period for your heart to heal, to make sure everything is goes good, and they don't have to go back in again. Which I for the most part, I feel like they did a really good job in getting everything done. Um, Other than that, I'm going to continue doing my daily blogs, how I feel, and step by step daily blogs that I'm going to be doing, just to say, okay, well, day one, this is what is happening, or there's something different that has changed. Other than that, I feel like this is my first video ever on YouTube. So if um, y'all have any questions, comments, or concerns, you can push the comment button. And if you like this video, give me a thumbs up. If you want to see more of the feature stuff that I do, you can subscribe and click the bell button there to be able to get my whenever my videos come up, you'll get a notification for it. I'm doing this based. I'm a 30-year-old male, and I have an uncommon um, condition at my age, and I'm trying to do this for the people on YouTube, because I only see one gentleman that's like in his 50s or 60s. I think in his early 50s, that had described how the cryoablation went, and I wanted to do this for the younger guys that are kind of anxious about what's going on, what the whole procedure entails, and for the most part, I will put a couple of links up here for like what the cryoablation does, if you want something a little bit more detailed. Other than that, thank you for watching, and stay tuned for future videos on my daily, day-to-day recovery of the cryoablation for the cardiac procedure. Thank you.